Today, most of our medical graduates scramble for a PG seat in medicine or surgery, and very few of them scramble for super specialization in areas like neurology, nephrology, cardiology, etc., gastroenterology, whatever. Okay. Now, these doctors, most of them are not aware of the emerging super competencies and super specializations in medicine, which offer a blue ocean for career growth. In fact, these are the super competencies and super specializations that might appear in the world's leading medical schools like Harvard and Johns Hopkins initially. And maybe in a year or two, it would make an appearance with the India's premier medical institution, the All India Institute of Medical Sciences. So the advantage with these new super competencies and super specializations is that there are hardly anyone in the field, and so the prospects would be immense, and there's hardly any competition in the field, and the world and healthcare requires professionals in these areas more than ever. So I would like to discuss 5 such super competencies and super specializations for the next generation of doctors. The first one is cancer immunology. So this you can call as a super specialization after oncology. Cancer immunology is now making waves around the world, and enormous amount of research is being done in this area. The difference between oncology and cancer immunology is the difference between clinical medicine and preventive medicine. So today the thought process is shifting to prevention of cancer rather than treatment of cancer. Treatment of cancer, as we all know, has a limited success rate. So cancer immunology is the thing of the future. It may be a super competency or a super specialization for an oncologist. Now coming to the next area. One of the most potential and popular super competencies and specializations in the future would be what's known as lifestyle medicine. Lifestyle medicine is going to be the thing for a doctor, especially to set up practice in a big metropolitan or international metropolis, because lifestyle medicine is the clue to prevention of most of the afflictions of the human race at this point of time, which are all actually triggered by lifestyle. So we might have a super competency or a super specialization in lifestyle medicine. We may have a super competency in clinical informatics. What that means is as the medical records slowly get transformed into EMR, electronic medical records, a complete analysis of the clinical information of the patient across time, from the earliest available record till date, needs to be processed in a usable and productive manner for a specialist to arrive at a decision, a therapeutic decision, which takes good care of the past of the patient. So clinical informatics would be a super specialization for doctors. Please note, only a doctor can handle this effectively and efficiently, not an IT specialist. Okay. Then comes the best, the most potential of the super competencies, virtual medicine. This is going to take the world by storm. In fact, a sizable amount of clinical practice would shift to virtual practice, where the doctor and the patient do the consultation and the clinical process online. So for a virtual medicine specialist, he is well trained on how to collect clinical data, how to do clinical examination to the extent possible, virtually or online from a distance. Now this is going to emerge as the specialization with the huge potential in the future. And then comes something which is rather, might sound funny. There's going to be a specialization called the nocturnist. This is a doctor who specializes in the night shift. Now you may wonder what is the need for a specialization in night shift. Things are not that simple. The doctor in the night shift is doing a kind of one-man show in most of the places and most of the departments. So he has to have skills. He has to be a kind of jack of all trades. He needs to have specialized skills in all emergency procedures. So the nocturnist is someone who is actually a generalist with specialized training in some of the emergency areas. Okay, so a nocturnist may be much in demand in the future. So these are the super competencies and super specializations of the future. These might appear in the curriculum of world's leading medical schools like Harvard and Johns Hopkins initially, maybe Oxford. And probably in 1 or 2 years it might appear in the syllabus of the All India Institute of Medical Sciences, followed by all the national institutes in medicine, and then probably the university affiliated local medical colleges. So guys who are now coming out with a medical degree, try and see if you can get into one of these futuristic areas, and if you can, your career is made, I assure you.